Everybody is looking for better healthcare solutions. What if AI could be the answer? AI in healthcare isn't just a buzzword, it's revolutionizing patient care. With AI, we can achieve more accurate diagnoses and personalized treatments tailored specifically to each patient. AI systems analyze vast amounts of medical data at lightning speed, identifying patterns that might be missed by human eyes. This means early detection of diseases, fewer errors, and more effective treatments. But the magic doesn't stop there. AI helps streamline administrative tasks, giving healthcare professionals more time to focus on what they do best, caring for patients. The result? Enhanced patient outcomes and improved quality of life. So whether it's predicting patient needs or making real-time decisions, AI is transforming healthcare, one patient at a time. Embrace the future with AI-driven healthcare solutions. Because better health outcomes start with better technology. Ready to take the leap? AI in healthcare, better diagnoses and treatments, making healthcare smarter, one innovation at.
So I'll just start with first question I had in mind was basically to know more about your background, Dr. Stefan, your experiences and so far career growth. So could you just share a glimpse of your, a bit of small introduction for us and for our readers or listeners we'll have for this conversation?
First of all, really thank you for spending this time with me, because I all know that even dedicating a little bit of time, and that time is really, really precious. And now I'm realizing it even more than ever at this time of my life. But one big thing that I would say is this, that my background is as a medical doctor. So that is like my real main background. The way that my academic journey first started off is through being a medical doctor. Now, of course, was being a medical doctor, I was always fascinated with technology all along the process. So I was always trying to figure out how to use technology to solve a problem. I used to be frustrated with some archaic process in healthcare, and I would say, why is that not resolved using technology? And that question always kept on coming up. Whichever organizations I was involved in, I used to use some form of technology. I was, for example, for a while, might be interesting for you, I was actually a photographer for a student organization, newspaper student organization within the University of Malta. So that was one thing, but the biggest one I was involved was my medical students, where I was involved with the website development. So all along the journey, I was always kind of taking this path. Then, of course, I graduated as a doctor. It took me some time, a bit more than expected, I would say, maybe because I was too much, let's say, trying to follow the technology route, where it was not fitting in the medical school box. And because of this, I took longer than expected. And then basically after that, I basically did 1 year of my internship, then took a 1 year break where I actually moved to Poland for a while for personal reasons. And then I came back to Malta, finished my internship, and then started a public health specialty. Why did I go for a public health specialty? First of all, at first I was kind of worried because essentially I was extremely motivated for digital health. But public health essentially gave me the relevant skills to enable me to think beyond technology and think more into policy. So it opened a world of possibilities. I was going to multiple conferences. In Europe, let's say, there isn't a specific specialty on digital health or health informatics. There's like a specialty training program, at least, which is diffuse across Europe, especially in Malta. So there was kind of this big challenge there that I had to overcome personally. So what I would say, if someone had to say, okay, so tell me your secret recipe. Well, my secret recipe is very, very simple, is that I am really experience-based. I constantly seek experiences that get me closer to technology. And for example, right now, I'm working as a public health specialist within the information management unit at the Ministry for Health and Active Aging in Malta. So there, for example, I get to work on cross-border health services. I'm also working on artificial intelligence. And And overall, I keep on every time I keep on seeking technology projects as I go along in my journey. And overall, I've met hundreds of people. Digital health is growing by the minute, literally. Every week there's something published on LinkedIn, and you just have to read it and try to. And my reading list keeps on increasing. But overall, I would say is that my experience so far has been experience-based and course-based. So I've always taken courses on artificial intelligence in healthcare. I did the data science summer school last year, for example. Right now I'm doing, for example, I just finished an open EHR technical awareness course, and I'm finishing off, for example, a FIRE bootcamp. So I'm always kind of experience and course-based. That would be, in summary, my journey so far. And that's really who I am.
That is very diverse, I must say. A lot doing in the AI. Although you're focusing on health, but you're doing a lot of segments. You're covering a lot of functions of tech AI, which is commendable.
Yep.
But
Yep.
just this puts me to the another question of you having the current responsibilities and day-to-day role you're playing in AI healthcare team. So I just want to understand what are your challenges, what are your interests, what is your motivation to find this topic as a very key and a day-to-day kind of interest of yours. So could you share some glimpse of that?
Yes. So Sheena, overall, like in my work at the ministry, at this stage is very much exploratory. But of course, in Malta, for example, we have a lot of national strategy in place to drive this forward. So my job overall is to really see what is the latest out there when it comes to artificial intelligence in health. Of course, driven by the frustrations that I might have faced whilst doing this work, I was very driven and motivated to work with my colleagues, Jelena Schmidt, Dr. Van Kessel, and Dr. Schute at Cienzano, to really dive deep to start getting some clarity overall on these challenges that are facing our, let's say, regulatory landscape. Because as much as we have now the AI Act, which is going to be very, very helpful in many different ways, you have to constantly explore. You have to always find new things. And overall, what we're looking at is that we're looking at developing policy. And clarity comes with policy, whatever form that may be. Now, of course, we went through the legislation route where we looked at binding policies in our work. But there's a lot of work to be done also in seeing how, for example, a strategy can support, or seeing, for example, how a guideline can support a clinical guideline. So there are a lot of these different things going on right now. So at the stage, we are like at an exploratory stage, but we're also kind of following very closely what is happening at a national level. So for now, let's say within the ministry, I am the person kind of really focused on artificial intelligence in health. Of course, there are other people who are working in different clinical domains, and they are working on their own pilot projects. But as such, there's massive opportunities ahead of us to really combine all of these efforts all together. So that's kind of what we're looking at right now.
So with this, it gets me to another question here. What are what are your major challenges in making the policy when it comes to AI implementations in the policymakers?
All right, remember that I come from a small state. So Malta, is a bit less than, it's like more than 500,000 people living in Malta. Of course, there are some priority areas that need to be focused on, and truly, I would say, before us going into any artificial intelligence, before us going into any delving deeper, we really need to focus on priority areas, and we keep on doing this right now. For example, making sure that our country has a national e-prescription system. We don't fully have that yet. We have partial, and that was doing quite good, but we need to have it full. So that is something that we have to work. This, in fact, like I was really struck by the idea of this data first, AI later, because really we need to get a lot of things in order. First, we need to get our foundation before we can build, the artificial intelligence. Of course, it's extremely important, nonetheless, to really monitor what's going through as well. So now my biggest hope is that with the upcoming EU projects that are being developed and the funding that is being really directed towards artificial intelligence in health, I see a massive opportunity for a country like Malta to really start establishing a team, start establishing a group of people around this topic, start establishing the right processes to make it really, really easy for people who want to really dive deep into this topic and really start taking it further. But as such, I would, if I had to kind of summarize like what we're looking at, we're definitely looking at resource challenges. There's always going to be a resource challenges. Why? Because in a country like Malta, even digital health human resources, they might be limited in number because of our size as of right now. And as such, we might be split over 5 to 6, 7 projects at some point. So, for example, artificial intelligence would be part of the portfolio, and we would have to follow up on other things, which even involved at EU level reporting as well. So, there are some priorities that we really need to take into consideration here. Nevertheless, I think overall, there is an appetite, and this is across not just Malta and multiple different countries. There is a appetite, especially with the AI Act, and not just AI Act, remember, but many other complementing acts like the Data Act, data governance. A lot of appetite right now is to really develop this further. So I think that if we take everything into consideration, I think we can get there. But one very, very good thing of Malta is that as such, we do have the foundations at a national level all set up. So, we have the Malta Digital Innovation Authority. We have a lot of things, all of these set up, guidelines, framework. So a lot of this work has already been done. We're not starting from scratch. Now, the biggest challenge ahead of us is to see how the national policies will bind with the healthcare regulatory needs. So, for example, we have a Malta Medicines Authority.
Yeah.
How will the Malta Medicines Authority, which also has medical devices within its remit, how will it all fit into the picture? And there we need to work on clarity overall. So how we're going to bind the national work and the health work, and that's going to come with the AI Act. So with this transposition and development, there are a lot of discussions going on right now in this matter, so that we kind of bring it much closer and make it much more real. So a lot of opportunities ahead of us. Keep in mind as well that when it comes to small states, most of the times AI in healthcare companies or AI in health companies tend to go towards a bigger country, even for regulatory needs. So that's going to be maybe a challenge, but also an opportunity to try to see how Malta can benefit from this setup, especially that the medical devices have to come into the picture. So these, I think, I would say, overall, are some of the challenges that we are facing ahead of us. I'm not sure if that answers your question.
Yeah, that literally does almost. But I also have a question of when it comes to, the ethical effects, that how much transparency is there in this transformation for you in this field, and how are you leading this further in the future, and where do you see actually AI transforming healthcare in next 5 years from now? So it's altogether a group question I'm asking. So you can take your time, share some real experiences, and it will really help us to give some examples to our listeners.
If I had to take a direction here, I think we need to really kind of look back a bit here and look back in history and try to understand how the regulatory environments evolved for the traditional drugs, how they evolved for the traditional medical devices without any software on board. So we are at the stage right now, we're in a transition stage. And I believe that within the next 1 to 2 years, especially now that there is even a legislation as a base, we are really getting closer to the point. We haven't got there yet, I believe. So we need to kind of keep pushing until we get to the tipping point. So I think one of the ethical implications that I'm seeing is this element of clarity. Even GDPR, essentially, if you go to the core of it, it is all about clarity.
Yeah.
So when we're looking at artificial intelligence, we're looking at clarity. So where is the data coming from? How is the model being trained? So where, what are we looking at in the first place? So that needs to happen, and it will happen. For example, just very recently, just today, I have already seen a map launched on ethical AI in healthcare. There is so in fact, if I maybe look at my LinkedIn right now on the side, I might even come to the actual post in question, because in fact I have a colleague of mine, Oliver Smith, in fact, who has just posted on his LinkedIn a map. It's called an ethical AI database. So there is already things happening, and there's already an evolution of the topic into making sure that, listen, these are the companies. For example, in fact, it's not on healthcare. I need to get correct. It's about the responsible AI ecosystem. So it's not just focused on healthcare, but overall. So I think that the direction that we are seeing here is about clarity, having an idea of, listen, how it is trained. That means that if I implement this artificial intelligence with my own population, what is the risk? Like what is like how what risk I'm willing to take to implement this? And the same happens with medical devices, and even drugs. When you are allowing a drug on the market, you are taking a risk.
Yes, of course.
This even a medical device. But what needs to happen then? Then monitoring needs to happen.
Yeah.
So in order for us to reach the ethical standards that are, I would say, that are being developed, and they're being also, implemented, I would say, because a lot of regulation has come into the picture. Now it's really about implementation. It's also about enforcement as well. That if someone doesn't follow there are two kinds of enforcement, I would say. There is the informal enforcement, where people they just find out that there is no data set being defined. It's not open source, for example, the models that being used. But there are a couple of things that come into the picture, and they say, it starts getting a bit, start questioning a bit. There's that is the informal enforcement, where people then say, I better not take the risk and not use that product. But then there is the proper enforcement, where if need be, an AI is recalled, if need be, or stopped, another review comes in. So there are a lot of these things, that come into the picture, and that also need to be thought about. Now, the real crux of all is like, how many resources are we going to put into implementing the act in the first place? So that's going to be the real picture. And we're going to face challenges as small countries, because there are already people like trying to implement in the other sectors, and they're trying to figure that out yet. So I think this is going to come into picture. So are we going to be able to maintain those high ethical AI standards, or will we have to take some shortcuts at times? Yeah. So overall, I think there needs to be a real deeper understanding of the implications at play, like what will happen, But I think there's a wonderful opportunity ahead of us to really kind of experience this, if anything, experience something that previous generations who have experienced like this tradition, like this move from the cowboy style of doing things, especially with traditional pharmaceuticals, to the proper regulatory with post-market surveillance and all these different items. So this is going to happen. It's going to happen very soon. So I'm definitely excited as well, because I would say that when it comes to artificial intelligence, let's say with traditional pharmaceuticals, this process, now of course I'm not a history buff myself, but I believe that with traditional pharmaceuticals, this regulatory process took much longer than what we're doing with AI in healthcare. I think it took much longer. But then again, this is good because you are like looking at high standards, and we really need these high standards. So I think we will have a really wonderful opportunity to really drive this forward, and make sure that whatever we do it because we want the patient's best health outcome possible. That should be our driving force and motivation.
So I have one more question on this one. Where do you see the gap? Where are you going to bridge this together with data and AI? How much are we going to take care of the data privacy of a patient, and how you're going to make this a seamless and effortless process? What is your planning for now?
Okay, if you would say that my personal planning overall, I would say that we first of all need to always look out for experts in this field, right? Because even if you are kind of exploring this topic, you need to start developing expertise, and that takes time. And there are already people who are already working on this field, and they're really like driven to work on this topic. So there's going to be the constant need for expertise, training, upskilling. So really, teams have to be developed to be able to handle all of this work that needs to be done. And if there isn't a team, there's going to be challenges. So that's going to be like our next big thing, I would say, is that developing the teams to be able to deliver this. Then again, please do not forget that there are many different regulations in place that already take care of data privacy.
Yeah.
For example, so there are these things that already come. They already take care of transparency, especially with the data transparency. So there are a lot of things already in place that take care of all of this already. So I think that's going to be our next big challenge so far.
Okay, great. So I think my questions are done. Paul, do you have any question here to?
Just to ask Stefan, how do you see, Stefan, that a movement like data first, AI later could have impact right now?
I think it's all about being pragmatic. I think data first and AI later will remind people that, and this is in fact I'm inspired by Dr. Morley here, who once said this: we're trying to build a high-speed train on rotting train tracks. We need to sort out the train tracks first. We need to sort out our infrastructure. We need to sort out our data pipelines. We need to sort out the way the data is flowing from one place. So I think this is going to be the next big change. Of course, the people will tell me, listen, but can't we try something? Because otherwise we'll never get there. And I tell you, yes. But make sure that whatever you're doing, you have a high quality data to start off with. Okay, so that is kind of to make it really useful. In the same way that before taking a decision on a particular drug, we try to collect as much data as possible about the patient, but to make the right decision. Allergies, all of these things. Like we try to understand the same way that we need to do with AI. I think one of the things that we're not realizing is that AI is not, I would say, a colleague of mine said that AI is public health. It is not personalized health. But I would say that in many different levels, it is both. So it can be implemented on personalized health, but at the same time, before it even gets there, we need to look at the public health implications. And that's why it's so beautiful. That's why I'm like grateful for my career journey, because it made me realize how digital health and public health are really deeply intersected. They are separate fields, but they're also deeply intersected because they're really about, the person, the person having a seamless experience. And data first and AI later, I think, has the wonderful opportunity of being pragmatic and really driving people, not as a naysayer saying, because you have to have good data quality, but like saying, okay, let's start with step 1, so that we have step 6 and step 7, so that we reach there, and we don't start back at square one because there was a problem at step 8 later on down the line when we implemented without looking at step 1. So I think it's if you manage as an organization to build really a solid argument and you keep on doing this, I think there's a really wonderful opportunity ahead of us to really drive the point across.
Unlock the secrets of healthcare data innovation and witness the future of patient care unfold. Dive into the Health Data Forum, where groundbreaking advancements and cutting-edge insights await. Explore the transformative power of data to revolutionize healthcare delivery and societal well-being. Join leading experts, thought leaders, and innovators as they delve into the latest trends and challenges. Experience the collaborative spirit of a vibrant community where ideas converge and partnerships flourish. Participate in discussions, share your perspectives, and contribute to shaping a healthier future. Stay ahead of the curve with our comprehensive video library, featuring insightful interviews and presentations. Catch up on thought-provoking conversations and engaging discussions that keep you informed. Together, let's harness the power of data to transform healthcare for the better. Join the Health Data Forum's mission to make healthcare data work for everyone.